Hello, my name is Georgia. I am one of the physiotherapists working at the Liverpool Heart and Chest Hospital, the Breathe programme. We are going to talk about coping with having a chronic respiratory condition. The presentation includes basic information about the main respiratory conditions, the causes of each, common symptoms, signs of a flare-up of your condition, and what to do when you're having a flare-up. Chronic obstructive pulmonary disease, also known as COPD, is an umbrella term used to describe chronic lung diseases that cause breathing difficulties. COPD is where air cannot get out of the lungs easily. This is known as airflow obstruction. So, COPD. The chronic side stands for because it's a long-term lung condition and does not go away. The obstructive part is because your airways are narrowed, as we've discussed, so it's harder to breathe out quickly and air gets trapped in your chest. Pulmonary is because it affects your lungs, and disease is because it's a medical condition. Within the term COPD sits two different lung conditions. The first condition is emphysema. Emphysema is a type of lung damage which causes difficulty breathing. Healthy lungs are made up of millions of tiny air sacs, also known as alveoli. These have elastic walls. These are where oxygen is taken into the body and the waste gas, carbon dioxide, is expelled. Cigarette smoke and other particles you breathe in can damage the walls of these air sacs. If you have emphysema, the walls of the air sacs in your lungs are damaged. The sacs break apart and merge into each other, creating holes in the lungs. The second condition is called chronic bronchitis. If you have chronic bronchitis, your airways are inflamed and narrowed. The narrowing of the airways affects how well and how easily air is emptied out of your lungs. Bronchitis can be short-term, known as acute, or long-term, known as chronic. In COPD, bronchitis is chronic. People with chronic bronchitis often develop emphysema as well. If you are diagnosed with COPD, you may be affected by either of the conditions discussed or have a combination of the two. COPD is a long-term condition with no current cure. However, there are treatments and medications to help you breathe more easily and help you keep active. There are also things you can do to self-manage your condition at home. It's important to be aware that COPD affects people in different ways. Some people with the condition have only mild lung damage and few symptoms. Other people have very damaged lungs and can feel very breathless and limited in what they're able to do. These individuals would be considered to have severe COPD. Causes of COPD. COPD usually develops because of long-term damage to your lungs from breathing in harmful substances. This is usually cigarette smoke and makes up 90% of all COPD cases. COPD can also be caused from exposure to smoke from other sources and air pollution. Jobs where people are exposed to dust, fumes, and chemicals can also contribute to developing COPD. Some people are more affected than others by breathing in harmful substances. COPD does seem to run in families, so if your parents have had chest problems, then your own risk is higher. A rare genetic condition called alpha-1 antitrypsin deficiency makes people more likely to develop COPD at a young age. Bronchiectasis is a long-term lung condition that affects the airways in your lungs. If you have bronchiectasis, your airways are wider and become inflamed with thick phlegm, also known as sputum. This means your airways may not clear properly, and too much phlegm can cause bacterial infections which can lead to chest infections. Chest infections should be treated quickly to stop lung damage. You may sometimes also hear bronchiectasis called non-cystic fibrosis bronchiectasis. This is because bronchiectasis and cystic fibrosis have similar symptoms. However, the treatment and outlook are different for both conditions. Around 1 in 200 adults in the UK have bronchiectasis. It's more common in women than men, and around 60% of people diagnosed with bronchiectasis are over the age of 70. It is not completely clear what causes bronchiectasis. For up to 50% of people diagnosed, there is no clear cause. However, some known causes of bronchiectasis are previously having a lung infection in the past, such as pneumonia that damages the bronchi of the lungs, underlying problems with your immune system that make the bronchi more vulnerable to damage from an infection, and allergies to certain fungi that cause the bronchi to be inflamed if spores of these fungi are inhaled. Other things may be having measles, inflammatory bowel disease, rheumatoid arthritis, or suffering from acid reflux. Asthma is a very common long-term lung condition. It affects people of all ages, often starting in childhood and also often running in families. In the UK, 5.4 million people have a diagnosis of asthma. That's 1 in every 12 adults and 1 in every 11 children. Some things make asthma more likely, such as a history of allergies. Currently, there is no cure for asthma, but there are simple treatments that can keep your symptoms under control. Asthma is caused by swelling, also known as inflammation of the breathing tubes that carry air in and out of the lungs. This makes the tubes highly sensitive so that they temporarily narrow. Asthma can be characterised by recurrent attacks of breathlessness and wheezing. This can vary in severity and frequency depending on the individual. Individuals with asthma can get symptoms like coughing, wheezing, feeling breathless, or having a tight chest. Asthma symptoms can come and go. Sometimes people may not have symptoms for weeks or months at a time. During an asthma attack, the lining of the bronchial tubes swell, causing the airways to narrow and reduce the airflow in and out of the lungs. Having frequent asthma attacks can make asthma worse over time. Asthma attacks can cause scarring in your airways, which makes them narrower. If your airways are scarred and narrowed, you're more likely to have worse symptoms more often. The best way to stop your asthma getting worse over time is to stick to good routine of taking your preventer medications as prescribed. There are lots of things that can make asthma worse, but not everyone will be affected by the same things. Things that set off your asthma symptoms are called triggers. Finding out what sets off your symptoms, whether it's colds and viruses, pets, pollen, pollution, house dust mites, or stress, means you can work out ways to avoid your triggers if possible. There are certain stages in your life that might affect your asthma too. For example, some women find that hormonal changes at puberty, pregnancy, or menopause can affect their asthma. Asthma needs to be treated every day, even if you're well, to lower the risk of symptoms and asthma attacks. Interstitial lung disease, also known as ILD, is an umbrella term that covers many different conditions which cause progressive scarring of the lung tissue. There are more than 200 different types of ILDs. All of them are rare, with idiopathic pulmonary fibrosis being the most common type of ILD. Interstitial means the disease affects the interstitium, a lace-like network of tissue that supports the alveoli in your lungs. When you have an interstitial lung disease, inflammation or scar tissue builds up in your lungs, making them thick and hard. This build-up of scar tissue is called fibrosis. As your lungs become stiffer and lose their elasticity, the gas exchange process becomes less efficient and the oxygen you breathe in can't move easily into your bloodstream. People with interstitial lung disease can feel breathless from simple everyday activities like walking. Coughing is also another common symptom. Causes of interstitial lung disease can include long-term exposure to hazardous materials such as asbestos, coal dust. Some types of autoimmune diseases such as rheumatoid arthritis also can cause interstitial lung disease, and a lot of cases also remain unknown caused. Idiopathic pulmonary fibrosis, also known as IPF, is a lung condition that causes scarring of your lungs and makes it difficult for you to breathe. It's the most common type of pulmonary fibrosis. Idiopathic means there's no known cause. Pulmonary is because it affects your lungs, and fibrosis is the name of the scar tissue in your lungs. Scar tissue causes the lungs to become stiffer and to lose their elasticity. This stops them working properly. They're less able to inflate and transfer oxygen from the air that you breathe into your body. If you have idiopathic pulmonary fibrosis, scarring affects the air sacs, eventually limiting the amount of oxygen that gets into the bloodstream. With less oxygen in the blood, you can get breathless from everyday activities like walking. Pulmonary fibrosis is a progressive condition. This means that it gradually gets worse over time. The scar tissue in your lungs cannot be repaired by the body or any drugs, and there is currently no treatment that stops or reverses the scarring. The current treatment, however, focuses on slowing down the rate of the scarring in your lungs and controlling the symptoms. Some people respond well to treatment and find their symptoms remain the same for many years. For others, the symptoms can unfortunately get quickly worse. It's difficult to predict how quickly idiopathic pulmonary fibrosis will develop because it varies a lot from person to person. There are no clear stages of idiopathic pulmonary fibrosis. It generally affects individuals who are around 70 to 75 years old. Despite idiopathic, meaning that the cause is unknown, researchers now believe that the body creates fibrosis, scarring, in response to an injury to the lungs. The initial injury to the lungs might be from acid reflux, which comes from the stomach, viruses. In some cases, idiopathic pulmonary fibrosis has been linked to certain viruses, including herpes, Hep C, and the Epstein-Barr virus, which causes glandular fever. Environmental factors, breathing in certain kinds of dust from wood, metal, textiles or stone, or from cattle or farming. And lastly, cigarette smoke exposure. It is not known if these factors directly cause idiopathic pulmonary fibrosis. Some people may also get idiopathic pulmonary fibrosis if it's in their family history, but this link is only found in a minority of cases. According to the 2021 survey by the British Thoracic Society, 5.7% of patients were found to have a known relative with interstitial pulmonary fibrosis. Diagnosis of chronic respiratory diseases. Initially, your doctor will gain a detailed clinical history from yourself. This will include discussing your history to find out any risk factors for developing a chronic lung disease. This will likely include family history of certain conditions, smoking history, and previous job roles or environmental exposures. They will also discuss your current symptoms that you are experiencing. You will likely then be referred for a spirometry test. This is a test that looks at your lung function and will be required to determine if you have a diagnosis of a chronic respiratory condition. You may also be referred for other scans such as a chest X-ray or a CT scan. There is also potential that you may be referred for a lung biopsy for your lung tissue to be analysed. An overview of the common symptoms that you may experience having a chronic respiratory condition. You may have a chronic cough. You may also experience wheezing. This is a sound produced when air is passed through a narrowed airway. You may find that you're coughing up more phlegm than usual. You may experience shortness of breath, especially when doing everyday things like going for a walk or doing housework. You may find that you hyperventilate and breathe more rapidly, and you also may find that you experience more fatigue. You may get these symptoms all the time, or they might appear or get worse when you have an infection, or when you breathe in smoke or fumes. These symptoms and having a chronic lung condition can cause secondary symptoms as well. This can include low mood or depression, anxiety, difficulty doing daily tasks and activities, loss of libido, or weight loss. Please speak to a member of the team who may be able to refer you on to other services if you are suffering from any of these symptoms. Long COVID or post-COVID syndrome. This is where full recovery from COVID-19 symptoms exceeds the 12 weeks mark. Common symptoms of long COVID include fatigue, shortness of breath, loss of smell, and muscle aches. There are various medications that can help to manage certain symptoms. These can include antihistamines, beta blockers, or inhalers. The best people to speak to regarding these are your GP, and they can refer you on to any other relevant services. In some cases, exercise can support reduction in symptoms, but it needs to be monitored at all times. Other symptoms that can occur, and it is important to remember that every case is different. These can be brain fog, chest tightness, issues with sleep, POTS, joint pain, or rashes. If you would like any further information, we would direct you to the NHS website. It's important to remember that there is continuous research happening regarding long COVID. What can you do to help? Keeping active is vital. You may find joining a pulmonary rehabilitation programme helps to guide you. Ensuring that you keep a good nutrition and eat well. You can see our nutrition talk for further information. Stop smoking. Know what to do during a flare-up. Ensure that you take all medications as prescribed by your GP. And ensure that you keep up to date with vaccinations. This can include your flu vaccine, pneumonia vaccine, and your COVID vaccines. Please contact your GP regarding this. Stopping smoking. Firstly, it's really important to say it's never too late to give up. Stopping smoking reduces the risk of further damage to your lungs and reduces the risk of other health problems such as heart disease and stroke. There is lots of support available. This can come from local services, your GP, practice nurse, or local pharmacist. The Breathe programme can also refer you to Smoke Free Liverpool. They can help to find the right way to help you give up. You can also self-refer yourself to Smoke Free Liverpool on their website. Exacerbations and flare-ups. It's really important that you know the signs and symptoms of when you're getting a chest infection and how to take action. We are going to discuss the common signs and symptoms of a chest infection. If you have 2 of the below, you need to take action by contacting your GP or 111. Individuals who have a diagnosis of COPD can also contact the Liverpool Community Respiratory Team if they have worsening chest infection and are at risk of a hospitalisation. Firstly, if you have an increase in breathlessness or wheeze, you may also find that you're taking your blue salbutamol inhaler more frequently. Secondly, you may find that you have an increase in the volume of phlegm that you're bringing up. And lastly, you need to keep an eye on your phlegm colour and consistency. If you have a change in this, your phlegm is becoming darker, muckier, and your phlegm may be becoming stickier and harder to clear, you need to take action. It's important that you know your own symptoms. There may be other associated symptoms with having a chest infection. This can include lower back pain, reduced sleep, loss of appetite, or increase in fatigue. Managing an exacerbation. It's important that you use your blue inhaler more if you feel that you need it. You may need to collect a sputum sample and drop it off to your GP to send off to the labs. This will allow your sputum to be tested to check that you're on the right antibiotics. It is also a good idea to collect a sample pot from your GP and keep it at home so that you're always prepared. Having a rescue pack in your house is also important so that you're prepared for any chest infections. Within a rescue pack, this will contain a pack of antibiotics and steroids. These are particularly good for over weekend periods or bank holiday periods when the GPs are shut. They are also useful for anyone that goes on holidays to take with you. If you start your rescue pack, it is always important to inform your GP. This will allow your rescue pack to be replenished as soon as possible, but also it will allow your GP to keep a record of how many chest infections you are having yearly. This will then be reviewed in your yearly annual chest review. It is important when you have a chest infection to continue to monitor your symptoms to check that they are improving and not worsening. What should you consider during an exacerbation? Ensure that you allow more time for daily activities and spread tasks across the week. Increase your rest time in between tasks and use the relaxation techniques that are discussed in the Managing Breathlessness talk. Ensure that you use breathing techniques to clear your phlegm. These are called the active cycle of breathing techniques. These can also be found in the Managing Breathlessness talk. Ensure that you have good food intake. You may find eating smaller amounts more frequently better. Be prepared by having meals in the freezer or tins in the cupboards. This will reduce the amount of effort you need to make a meal. Ensure you also increase your fluid intake. Having a good fluid and food intake will allow you to get over your chest infection quicker. Danger signs, what to look out for and when to call 999. Firstly, if you are so breathless that you cannot complete a full sentence, it is vital that you call 999. If you experience any chest pain, in particular in your chest, radiating down your arm, up to your jaw or into your back, please call 999 immediately. If you have an increased level of confusion or drowsiness, please contact 999 immediately. If you would like any further information about other support in your local community, please look at the support section on our website or ask a member of the team. The link to our website can be seen on the screen now. Thank you for listening to our talk today, and we hope you found it helpful.